Hello everybody, welcome to my YouTube channel, Nurse Ed Simplified. So today we will discuss a very quick topic but very important one, that is the Glasgow Coma Scale. We will do like an easy mnemonics and tips of how to remember the Glasgow Coma Scale. Always remember, when somebody will tell you about Glasgow Coma Scale and how do you present it in your answers, it will always be a 5 marks or a maximum of 6 marks answers. So your answers should be limited but precise and concise and informative. So you must be able to cover all the aspects in that one answer. So let's see, how do we do that? You will start with an introduction as to what is a Glasgow Coma Scale. The history goes back to 1974, where it was published by Graham T. Stale and Brian J. Jennett. Who were they? They were professors of neurosurgery at University of Glasgow's Institute of Neurological Sciences at the city's Southern General Hospital. It was initially intended and used for post-head injury patients, and today it is widely used tool to assess the level of consciousness in patients in a variety of clinical settings, and is one of the recommended observation tool with head trauma and pathologies. The patient is assessed against the criteria of the scale, and then the resulting point gives a score between 3, that is deep unconsciousness, to 15, full marks, that is full consciousness. What is the purpose? The scale aids in evaluating brain function. Along with it, it standardizes your assessment. It provides a consistent, objective way to assess our neurological status of the patients across healthcare settings. So, not only in India, you talk about US, you talk about UK, this is a standardized tool. So, someone using in India a GCS of 8 by 15 would mean the same to a patient in US or UK. So, it is one of the standardized observant tools. To monitor the neurological changes, it helps detect deterioration or improvement over time. It helps to guide clinical decisions, whether the patient is for ICU admission or intubation or neurological consultation. It helps to communicate the patient's status. That is, when you tell that a patient has a GCS of 9, that is enough for the physician to decide what to do next. So it is a very fast and a common shared language for the healthcare professionals. The triaging and prioritizing care. So when you talk about GCS, it mainly means with patients in trauma, emergencies, and ICU settings. Components. It has 3 basic components: EVM, eye opening, which is the maximum score is 4; verbal response, the maximum score is 5; and motor response, the maximum score is 6. A total, it will be of 15. So a GCS 15 by 15 means the patient has a normal GCS score. Here is the breakdown. And the eye opening, if it is spontaneous, it is full marks 4. If it is to speech only, that is you are calling and then he is opening the eyes, so it will be 3. To pain, you are giving some sort of sternal rub, or you're giving some sort of pain stimulus, and then he is opening his eyes, the score will be 2. And whatever you do, there's no response, it is 1. Verbal response, you are talking to him and he is oriented to the place, person, time, everything. Confused is, you are asking something but he's not giving you the same response. You're asking about the time, he's telling maybe it's afternoon, but actually maybe it's morning. Inappropriate words, you ask him something and he will tell you something very different from what is the actual data. Like, for example, you are asking him, tell me something about your family. I am very drowsy now. I feel like I'm in the garden now. Or he will use new words which are not appropriate to the situation. That will give you a grading of 3. Incomprehensible sounds, only you can hear sounds. Some sort of it can be monosyllable, it can be bisyllable, whatever, but you can only hear sounds. No response is a grading of 1. Motor response, that is how well is he using his motor senses. He obeys your commands, whatever you say. that will be a score of 5. He localizes to pain, that will be a score of 4. Withdraws from the pain, it will be 4. Flexion, decorticate position, it can be 3. Extension, that is whenever you whenever you see a position, you will see it is becoming decerebrate posture, it will become 2. And there is no response whatsoever even to pain. Without pain, it will be 1. And so you calculate them together, E plus V plus M, and that will be 3 to 15. It can be anywhere between 3 to 15. In the next slide, we will tell how to interpret it. When you talk about interpreting, when you say 13 to 15, it is mild brain injury. 15 out of 15 is fully oriented. 13 to 14 is mild brain injury. 9 to 12 is moderate brain injury. Less than 8 is severe brain injury. Now let's go to some practical application. Patient opens up eyes to speech. For example, you see E3, uses inappropriate words. You will rate it as V3. Withdraws from pain, it will be M4. And the last but not the least, it will be your total score will be 10. So it indicates moderate brain injury. What is the nursing responsibility? Any question that you get for 5 marks, never leave the question without writing the nursing responsibility. But mind it, do not waste your time on formulating a care plan unless asked. Finish it off with a nursing responsibility or finish it off with a nursing role. So what are your nursing responsibilities? Number 1 is to perform accurate and timely assessment. Assess the GCS on admission and at regular intervals. Reassess after there is any change. Use painful stimuli if you do not get a proper response. Understand the GCS components very well. Know how to assess the EVM. Be consistent and objective in scoring. Document your findings clearly. Record the individual's component scores. Whatever you get, it must be accurate, and you must be it is because it is one of the components which will decide what to do with the patient. Note the stimulus used. Like when you say pain, that he is responsive to pain. So what pain stimulus did you give? Recognize critical scores. If it is less than 8, you should know automatically when your nurse tells you that during a shift of change, or whenever you see a file of a patient and you see GCS 8/15, you must know there has been a severe brain injury to the patient. Sudden drop in the GCS is a medical emergency, so report immediately. Ensure patient safety. Monitor airway, breathing, circulation in an unconscious patient. Position the patient appropriately to prevent any aspiration or fallback of the tongue or injury. Communicate changes promptly. Notify the physician of any decrease in GCS, new onset of abnormal responses, or posturing. You cannot, that is what we were talking about. Decorticate, decerebrate. And educate family and care team. Do not do everything on your own wish. Involve your family in care planning. Explanation, psychological support, inform the changes and why we are doing this for this, and so on. So as it is in a nutshell, assess, evaluate EVM, monitor, regularly check the GCS to identify the changes, document, record the GCS scores and related observations accurately, and report to the physician if you change any deterioration or any abnormal findings. This is just a mini quiz. Put your answers in the comment box. A patient opens eye to voice, speaks confused, and localizes pain. So what's your GCS score? Thank you so much. Please subscribe, like, share, and support. Do put in your comment box what are the concerns or what are the topics that you would like to be discussed. Thank you so much. Bye bye. Take care.